Hi, this is Dr. Dumestre, and I wanted to talk a little bit about sensation after mastectomy and breast reconstruction, specifically using a DIEP flap. So what happens after a diagnosis of breast cancer when you're pursuing treatment of that with a mastectomy? The general surgeon is actually coring out your breast gland, separating it from your overlying skin and sometimes nipple. In that process, you are losing both the blood flow that goes through that breast gland to feed the overlying skin, which places you at risk for certain wound healing complications, but you're also losing the nerves. So all of those little nerves that ultimately give you feeling both to the inside of your breast and to that overlying skin. So this is an area that reconstruction is still lacking, meaning that we're quite able to restore beauty and the appearance of the breast, but what we have not come to terms with yet is how do we restore full feeling of the inner envelope and your outer skin. Now, DIEP flap reconstruction, so using a big piece of skin and fat from the belly, which is transferred over to the chest, is your best bet of regaining a sensate, so something with feeling, reconstruction. So I've been innervating these all now for the past year, and what that means is that the piece of tissue harvested, which is almost like a same person transplant, a little piece of nerve is taken with that. And then in your chest, where I connect an artery and a vein to give that tissue life flow, I'm also finding a little nerve in your chest and hooking that up to that big piece of fat. Now, this does not give you 100% sensation, but its goal is to give you at least some tactile sensation and some knowledge that you don't just have two numb breasts, you've got some healthy living tissue there that feels like your own breast. It usually takes 1 to 2 years to reach a plateau in that sensation and in that outcome. And it depends on multiple factors, so not everyone will see the same degree of improvement. That being said, there's really no downsides to doing it. When we look at the studies, there's no increase in pain, there's no increased loss of numbness to where that tissue is coming from. And in this case, for natural tissue reconstruction, it doesn't require the use of any donor nerve, so it's all still using your own tissue. I'm hopeful about what the future has to bring for breast reconstruction and sensation, but in the meantime, we have reached a little bit more of our goal as far as restoring both function and form.